Well, hello. This is Kris Tefft here from quarantine at WSIA. I'm joined today by Jim Nylander, Program Manager for Self-Insurance at the Department of Labor and Industries. I'm obviously the Executive Director of the Washington Self-Insurers Association, and we are recording this question and answer period, this discussion, hopefully to be informative for attendees to the May 7th online annual conference. The plan here is that this recording will be made available on demand. Hopefully Jim's staff of training and certification crew will assign some degree of credit for it, depending upon how long we go. And hopefully it can inform folks on really some important things that are going on right now in workers' compensation at the department, in self-insurance, things that happened at the legislature in what feels like a different world ago, just a couple months ago, and kind of what the future might look like, as well as some rules that are under development at the department, both in progress that we may overview a little bit, as well as some rules that the department is going to have to take on in the future at the direction of the legislature. So, excuse me, that is our goal. My cough is from allergies, so don't worry about that, folks, out there. You know, it's a very difficult time to have any kind of symptom like that. So, Jim, how are you doing?
Doing great, Kris. Thank you. Thanks for inviting me to
Thanks for joining me. So, how are things going? What you're obviously not in your office at the town center there in Tumwater. How's it going? How's work been impacted? What are you guys all doing?
Well, gosh, you know, first of all, I think that the coronavirus pandemic has really impacted all of us and in different ways. For us in self-insurance, we understand that many employers are facing a variety of challenges right now. And we want all of you to know that we've heard from you, and we are hearing you, and we are here to work together with you to ease the burden of these challenges, so that you can focus on meeting your business needs and the needs of your community. So for us in our office right now, all of our staff are working their normal schedule from home. Our claim managers can take calls. You can contact them at their normal business numbers. Our performance measurements remain the same, and the order requests are at this time being processed as usual.
So when you say performance measure, you mean the number of days that you are hoping to get certain kinds of work orders out, different closure orders, allowance orders, and so on?
Yes, exactly, Kris. Our aim is to not have the time frames interrupted. So far, we with the transition, we've been able to continue to manage that work within the expected time frames. So
how does that work in terms of just the nuts and bolts of your staff working remotely? Did you outfit everyone with laptops, and do the calls ring through? I think you mentioned you could call folks at their normal number. Does that ring through their computer then? Can you leave a message?
Yeah, no.
Does that all work?
Great question. And it's been a big challenge for us. And one of the biggest challenges has been to get all of our people ready to work from home. And this meant equipping each with laptops and supplying soft phones so that all our staff could answer phone calls directly at the existing phone numbers. And one other challenge has been processing mail. And many of our areas in self-insurance
Okay, so we're just coming back from a little connection blip there. So Jim, you were saying you're talking about a challenge with getting folks set up to work.
Yeah. Yeah, really the biggest challenge has been to get all of our people ready to work from home. And this meant, equipping each with laptops and supplying soft phones so that we could answer phones directly at our existing business phone numbers. One other challenge is, Kris, has been processing mail, and I'm sure others have experienced that too. Many of our areas still use a paper-driven process that adds a level of complexity when we're working remotely. So that's been a challenge. Um, but with those challenges, there comes opportunities too. And really the greatest opportunity has been to assist our customers with, both employers and workers with answering many of the questions that have arisen with the COVID-19 and workers' compensation.
Well, let's transition to that for a second. But before we do, another kind of nuts and bolts question for people that need to communicate with the department. They can, obviously, you mentioned they can call their staff contact. Do you recommend email? Is that likely to get a faster turnaround, or is it just kind of the same? Maybe leave a voicemail or send an email.
I think through the voicemail, calling on the phone is the best approach right now. We do have some, confidentiality concerns with using email right now.
Okay.
So we're not really set up to address those concerns. In the future, that's our business with our self-insurance customers through kind of a secure email process.
And I think you've mentioned that in light of the issue with processing mail, you're asking folks to transmit documents through the secure file transfer
Yes.
portal. So
the more we can do electronically like that, the better.
Okay. Well, that's good information for our frontline claims folks out there to just know that the people that they need to be talking to are there at work, still working under the same performance expectations and available to get back to them. So appreciate that, Jim. So COVID-19, what a different world we are in the start of May. It was, I think, May 5th when Governor Inslee held a press conference with Director Sachs and others and announced a new policy for workers' compensation with respect to healthcare workers and first responders in the very kind of early days of Washington State being impacted by this pandemic. And obviously the department has had to put out some information about that policy. And of course, it impacts self-insurance as well. So there's been a fair amount of questions that have been raised and some additional clarifications. So starting at maybe the 50,000 foot level and drilling into it, could you kind of give us an overview of sort of what's changed now in the claims environment after COVID-19?
Yes, you're right. With our kind of the announcement of our policy, how we were going to approach the COVID-19 issues, we early questions really largely centered around the payment of benefits during the quarantine period, and so we wanted to address those issues through our FAQs. And so we've put a couple different sets of FAQs out there. And more recently, the questions have centered around who can authorize workers to be quarantined, and just some more clarification in that regard. And so and especially there's questions unique to processes for self-insurers. So in addition to the coronavirus and workers' compensation common questions that apply to all workers' compensation issues that we as an agency, L&I, put out there for folks on our website, we also saw a need to answer questions that were unique to self-insurance processes. So we developed 2 sets of FAQs, and you can find both on LNI's public website on our COVID-19 resources page. And
I've pulled that page up.
Yeah, yeah,
See.
thank you. You know, just pulled that up. Folks can find that by just going to our main LNI webpage, and on the search feature on that front page, just type in the lower one, Chris. I think it works a little easier. There's a search function right down below. Yep, perfect. Type in COVID-19. And then click on the, you can click on either our, if you go up, Chris, you can click on the first one, the novel coronavirus outbreak COVID-19 resources. And that takes you to all of our resources at LNI, safety and workers' compensation, health, about COVID-19. And then on that same page, if you scroll down a little bit further, Chris, we have our workers' compensation FAQs. And so we have the general common questions for workers' compensation. And then we have our specific self-insurance and coronavirus common questions.
So going into the self-insurance common questions, you know, what at kind of a general level, and maybe we'll drill down a little bit, but what have been the common questions that your staff has had to address since this policy came out? Again, we're mostly, are we not, about quarantined workers, healthcare workers, first responders?
Yeah, great question, Chris. Thanks. We, you know, because we anticipated that the healthcare workers and the first responders would be more likely to have work-related exposures, we used these as examples in our general workers' compensation common questions. And the criteria that's in those general FAQs for determining whether a claim may be allowed applies to all industries. So while there are some unique aspects to healthcare workers and first responders, it can apply to any worker in any industry. And so we encourage folks to look at the criteria that we've provided in those common questions for workers' compensation, and then also supplement that with our self-insurance FAQs. Our self-insurance specific
let me interrupt you for a second, Jim.
Oh, yeah, go ahead. Thanks, Chris.
Folks are looking at the right documents. So you're saying you start with the workers' comp common questions?
Yes.
And that's for everybody, state funds, self-insurance.
Exactly.
Employers.
Yeah, and if you go down a little bit, it'll speak to the idea of, let's see, we continue to add some things.
Can COVID-19 ever be allowed as a work-related condition, for example?
Yes, and so there's some of the criteria, and then, you know, under when to file a claim, you know, we talk about the following criteria that should be considered. And generally what's aimed at there is that it's the exposure needs to be specific to the employment. In other words, there has to be a work-related connection. Distinctive to the employment, maybe is the best way to describe it.
I see. So a person would start with this document and take into account the criteria, and then would, in the self-insurance world, then would move on to the document that I had up a moment ago, the more specific self-insurance.
Yeah,
that's
right.
When to file what kinds of paperwork on a claim, the SIF2 required, not required, and
yeah, the SI specific FAQs are intended to supplement the general workers' comp questions, not replace them. But there are unique aspects of self-insurance, and self-insured employers all have different processes for evaluating workers if they've been exposed to potentially to the coronavirus. And so one of the things that we aim to do in our SI specific FAQs is provide for flexibility for those individual self-insured employer protocols. And whether it's a public health officer that's established a protocol for a self-insured employer, or a physician that's set the protocol in place, we are good with employers putting that protocol together, and we are good with working within that protocol to process the claims.
Okay.
Really, our most recent addition to our SI specific FAQs, Kris, was aimed at those specific issues: who can direct the worker to quarantine? What if I already have medical protocols in place? And our aim again was just for flexibility for employers to be able to work within the medical protocol that they established for consideration of claims.
Maybe a little bit of a tangent off this, but it's hard to see a doctor right now. It's hard to see some of the different providers in the system right now. What's your thoughts on telemedicine and how quickly we've been introduced to that reality as potentially part of the workers' comp system?
Yeah, my peers over in our health services analysis program within our insurance services division have been doing a lot of work around getting telehealth policies in place, payment policies, processes in place. And folks may have seen some of our Gov delivery messages that have gone out in that regard. But we're aiming to work with that in as much as possible with the workers, the employers, and the doctors to help make things work during these extraordinary times.
So if self-insurers have a question about telemedicine, you would direct their inquiry to the health services analysis program, or would they start with self-insurance potentially? And
yes, I think, well, certainly always they can contact us, especially if it's about a specific self-insurance claim, and we can help walk through the process together. And but we can also then, we would, if it's more of an involved issue, we can work with our health services analysis program folks to kind of help look for a resolution to whatever the issue may be. One of the things that we do want to encourage folks to do, and it's in our FAQs, is that at times the workers may not be able to get in to see a doctor when there's a quarantine issue. And so we're looking to your protocol that's in place, where they may not be seen by a doctor, but you have a protocol in place where they can be quarantined and process the claim without having them seen by a physician or a medical doctor first. And then we will work with you as needed to either just receive the medical protocol, the documentation of that, or if it's desired, to later get documentation for the quarantine or the condition testing and related aspects.
A real nuts and bolts issue here that I know has come up as a question. We put it in our newsletter, I think last Friday, to our members, but a question arose just about when a COVID-19 claim is filed, how to code that claim for purposes of the CIDRS reporting. And we had shared, for folks' benefit, that your staff had recommended using the codes 199 for other miscellaneous causes, 273 for contagious disease, and 360 for lungs. Does that sound still about right?
Yeah, and you can find those codes on our self-insurance webpage out on the public website. In fact, Chris, if we want to look at that briefly, we can do that.
Sure. I think we can.
Yeah.
There.
So let's go to, there's a section that we should have there on, let's see.
Claims management?
Let's see, I think it's under, sorry, I think it may be down under employers. And let's scroll down a little bit. And I'm looking for our reportings. Reports down on the left-hand column. Let's look there, Chris, and see. And I thought we had something on there about, let's see. Okay, so yeah, I'm not seeing it right offhand. Sorry, I will get that and send that out to you.
Okay. You know, I think that question could come up from time to time.
Yeah.
But maybe before we leave the COVID world, one thing I wanted to ask you about and kind of highlight is the apart from claims management, the extent to which the department is offering some relief from assessments under certain circumstances to self-insured employers who are dealing with quarantine situation, or who are dealing with shutdowns or remote work or COVID claims themselves. Can you maybe give us a quick overview on the impact on assessments?
Yes. So basically, the administrative assessment, we aren't going to be charging folks for the cost of the COVID-19 claims. And we're planning to have a quarterly report, our quarterly reports modified by next quarter, so that employers can note the total claim cost of the COVID-19 claims, and they'll be asked to provide a supplemental addendum that shows the list of claims that were COVID-19. And then they can deduct that from their total claim costs, and employers won't be charged for that in their own individual administrative assessments.
Okay. Anything else before we sort of step away from the COVID-19 specific issues?
Yeah,
I'll say this again at the end of our time here today, but obviously, since this is a recorded viewing, there isn't the opportunity for participants to weigh in with questions or anything. But if anything that we say or anything that the department is working on provokes further questions, I know that myself or Jim would be happy to route those to the right personnel. So, any additional questions that viewers of this have on these issues should probably email me at WSIA, and I can route those to Jim or to the applicable staff for a quick answer. Is that fair, Jim?
Yeah, absolutely. And there's so many questions, and we want to be able to help people with answers to all that we can. Kris, regarding the assessments, I was just going to add too that for the supplemental pension fund assessment, if employers continue to pay their workers, but the workers aren't working, they don't need to report any hours for the time that they're paying those workers, and the workers aren't working. So they won't be charged for that assessment either.
Okay. Well, let's transition out of the COVID issues. Obviously, those are top of mind right now for everybody, but there's a lot of other important work that's going on that we should talk about a little bit and update folks on. And so, maybe just to talk about claims management stuff in general, we are coming up on the 1-year anniversary of the rules modernization package going into effect July 1st of 2019, and that brought with it the sort of end to the requesting of routine orders from the Department on claims management issues, and placed in its stead a kind of a communications protocol to use department provided forms and templates and so on for employers to communicate their own claims decisions to workers between the bookends, so to speak, of allowance and closure, which the department still remains responsible for in most cases by law. So, just in general, how's that going? One of the important principles was that the department would not be involved in the day-to-day claims management decisions of a self-insurer unless there's a dispute and a worker asks the department to intervene to adjudicate the dispute. Curious if that's happening very often. How's this new system going just about 1 year in?
Well, it's going good. And we recently held focus groups with members of the self-insurance community to evaluate and give feedback on the forms and letter templates. We also sought feedback from the Ombuds's office, and there were some minor suggestions to improve these forms and letters, but no major changes. And so we plan to communicate these new forms and letter templates soon out to the community. And so really the claim rules modernization goals of greater certainty for employers, better communication to workers, and improved alignment with the statute are being met. And the number of disputes has generally remained steady at about 150 per month, while the number of department issued wage orders, as you mentioned, Kris, kind of our routine wage orders there, has decreased from about 750 per month to closer to 100 per month. And as a result, we continue to monitor the trends to see how we might be able to improve our services in other areas for employers and workers. And employers and workers alike have generally responded positively to these new processes.
So you say you're issuing about 100 wage orders a month. Is that in response to disputes, or are you still processing certain kinds of requests for wage orders?
I need to go back and look at exactly what, inside those wage orders. But let me follow up on that and kind of see what the genesis is for this.
Okay. Yeah, curious. What about audit? That's a related area that is obviously still work that's ongoing. The department's in, maybe 5th or 6th year of the new audit model, and there have been several cycles. I think we're in a third 2-year cycle right now, if memory serves me. What's going on in the audit world real quickly?
Yeah, so as you mentioned, under our reformed audit model, we conduct performance-based audits on a 2-year cycle, and we're currently just 5 months into this cycle, so it's a little bit harder to assess if we're on track to complete each of the 3 tiers of the audit. Really, all 3 of the performance-based audit tiers focus on delivery of benefits, and so timeliness, accuracy, and entitlement. So one of the things, though, as we conduct these audits and in view of the impact of the coronavirus pandemic, We're communicating to the employers that they can request extensions for providing requested information to us and to just let us know. You know, it may slow things down a little bit in our audit cycle. However, we really do recognize that many are working remotely, and it's much harder to pull together the needed information when you're staying at home. So, but as part of our reformed audit model and the new standards, we do meet regularly with our audit governance committee that consists of business and labor representatives to advise, you know, on the plan and consider adjustments as needed.
Okay. Okay. I think that folks will appreciate the flexibility and kind of forbearance because of all of the work interruptions that are going on right now. So
Exactly. Yeah.
important. Let's transition over to certification and testing. You know, this is a kind of an offshoot of the rules modernization project where with respect to the certification, come July 1st of this year, it was originally intended that all out-of-state persons handling Washington claims would have the department's certification, and you know, July 1st of next year, all folks to be certified would have to have completed a 72-hour comprehensive goal-oriented curriculum in order to sit for the certification test and achieve a workers' comp professional designation to do that. I understand there have been some changes a little bit in the time frames around that as a result of the work interruptions under COVID-19. Can you give us a feel for sort of what's going on in the certification testing realm?
Yeah. Yes, for sure, Chris. Thanks. You know, due to the governor's stay home, stay healthy order, first of all, our June 2020 certification test has been canceled. And also, as a result of the coronavirus outbreak, LNI is providing a 6-month extension for certified claims administrator certifications, and that would have otherwise expired between March 20th and September 30th, 2020. We're also extending the time for every person outside the state of Washington making claim decisions to be a certified claims administrator from July 1, which was the effective date of the rule, to January 1, 2021. And so, yeah, it just seems like the times call for flexibility right now, and that's what we're aiming to, you know, provide for our community.
Can you talk a little bit about the work that's underway around the substance of the certification test itself? You know, there's a lot of consternation in the claims handler community about the test from the standpoint that passage rates historically haven't been as high as any of us would like, and you know, it's given rise to some, you know, some fairly pointed concerns about the test itself and the questions and the manner of taking it and so on. You know, when people's ability to do their job, if certification is required to do it, is on the line. So, you know, we've talked about this, Jim. I think everybody is aware of that, and maybe you can update folks on some of the department's thinking around, you know, upcoming changes to the test itself, including, you know, kind of aligning it with the rule that spells out what the professional workers' comp professional curriculum is supposed to teach, for instance.
Yes, absolutely. And Chris, you're right. You know, testing can be a complex and controversial process. And so we want to make sure the test evaluates the right thing and measures the desired level of learning. So one of the things that we're doing is we're contracting with a private instructor to assist with the development of the content and design of the format. And our aim is to have an objective test, not subjective, that measures competency, not mastery, and that aligns with the new comprehensive core curriculum.
And that shift from mastery to competence, it's kind of a subtle thing to say, but that's a very important kind of guiding light for the new test, right? You know, the old standard was sort of that this was a certification that maybe the elite, you know, best of the best claims would hold. Supervisors and so on, whereas, you know, the expansion of requirements, and we're going to talk about it a little bit more with respect to legislation as well, but the expansion of the desire to have the training and demonstrate the effectiveness of that training through the test. I mean, that kind of requires the department to look at it in a little bit different way of what you're actually asking people to demonstrate, right?
Yeah, that's right. We, you know, it's going from a, you know, a past state where a few were certified to a future state now that's coming up that will involve everyone that manages workers' compensation claims to be certified, and to also participate in the training in support and in preparation for that test. And from as we've talked and you've shared about the anticipating by the end of summer having graduated your first class of the Washington Workers' Compensation Professionals under the new 72-hour curriculum, and that's a tremendous accomplishment. And I really believe that the best trained workers' compensation professionals give the best help to our state's injured workers. And so here at LNI, to kind of coordinate with those timeframes and sync them up, we're aiming to have the test for the new curriculum ready in September.
Well, that's great. That'll be a big piece of work for the department, certainly, and hopefully in the next 4 months or so that can really happen. Thank you for mentioning the WSIA's WWCP designation. Far be it for me to direct listeners to www.wsiasa.org/WWCP to hear about the 4 classes that are left in this first year of the 72-hour curriculum that are remaining. We've had to push them back into the summer a little bit from their original dates, and we've had to switch them to primarily a remote option, especially for the next couple ones in May and June. They'll have to be broadcast to attendees in a similar way as we're broadcasting our annual conference. Maybe come late June or July, we can have limited sort of in-person classroom attendance, subject to whatever public health requirements and guidance is available at that time, if it's safe and allowed. But yeah, we are definitely going to finish that all 72 hours, and we were thrown a little bit of a curveball here, just like everyone else. But it's our commitment to the folks who started it, as well as others who just benefit from those particular training subjects without regard to the professional designation to take. So I'm glad to hear that the test is going to be in closer alignment with what folks like us are teaching in those classes. So that's some good news, as they say. Let's segue a little bit to something different. This is kind of a grab bag of updates and things to talk about, and I'd like to talk about the legislative session and some of the legislation that took place for a minute, and maybe look ahead to what could be coming down the pike. 2 really big bills passed during the legislative session. Senate Bill 6440 with respect to independent medical exams, excuse me, and House Bill 2409 with respect to penalties, but in the self-insurance world, TPA licensing and certification of all claims handlers in the future. I guess, Jim, I'll talk in a second about maybe some of the requirements there, but what's the department doing to get prepared for the new world that these two pieces of legislation sort of ushered in?
Well, sorry about that. My screen just closed up for a moment. We know that there's going to be a lot of work ahead for us and our stakeholders. For Senate Bill 6440 concerning the IMEs, Joel, Vicki, and Mike will be Joel Sachs, Vicki Kennedy, and Mike Ratko, director, assistant director, and deputy assistant director, respectively. We'll be getting information from the legislature soon on the participants for the required legislative work group. And as you know, Kris, the law provides who should be on that work group, and it's got a number of, it's got legislators, folks from L&I, also business and labor representatives and self-insurance representatives. The process for bringing that work group together is currently under consideration, but I know the folks are looking at that closely.
So in addition to creating that working group to talk about future changes to the IMEs, Senate Bill 6440, it's worth saying, I mean, had some some specifications put into play right now, particularly around sort of this concept of reasonable convenience to the worker for an IME, both in terms of distance or in the instance that no specialist in the required field is available in the workers community, what kind of accommodation could have to be made. And especially, we talked about telemedicine a little bit earlier in regard to COVID-19. When this bill was written and debated and passed, I don't think anybody thought that telemed would explode the way it has, but it actually brings this notion of telemedicine into the IME world and requires the department to draft some rules to figure out when it's appropriate to do telemedicine in IMEs. And that's apart from the working group that you mentioned. That's something that the department's going to have to break off and figure out. Do you have a timeline for when that work might get underway?
I don't have a specific time frame, Kris, but you're right. The statute, the new legislation provides that the department may adopt rules concerning that area, and then also the area in the statute that provided some new parameters around the purposes for IMEs that could be used for those purposes. So we do anticipate that there may be some rule development that needs to happen. And also, I think that, with the advent of the use of telehealth in many of these areas now, that that may be explored as well as in regard to possibly making some rules permanent in that regard.
Yeah, I think it's fair to say this wasn't a bill in its original. And this is WSIA talking, not the department. But this is a bill that, in its original form, was not supported by the self-insured employer community. It really came from a point of view and a perspective that IMEs, as they're handled now, are problematic for the worker community in a few different ways, and particularly the number of IMEs that happen in a particular claim. Sort of the idea that sometimes the exams can be invasive or leave the worker sort of uncomfortable with how they've proceeded. Concerns about specialists from out of state or self-insurers picking the particular examiners that they want to use and scheduling them and so on. And, it was part of the legislative process to debate that out with the competing stakeholders and legislators. And, what came about as the result of that debate and discussion was kind of the bill as it passed, which, really, I don't think is meant to make a lot of changes to the status quo, other than with this idea that the exams have to be kind of reasonably convenient to the worker. There's a provision in there about, no-show fees are being prohibited if a worker cancels within 5 days of an exam. And then there's an important new provision about, Jim, I think as you mentioned, the permissible reasons for an IME decision on allowing or reopening or resolving a new medical issue. And that notion of a new medical issue is kind of something new in the statute. If there's an appeal or to do case progress or to evaluate for PPD or work restrictions, those are some of the specifically enumerated reasons that an IME can happen. And that's, I think that's more or less encompasses the universe of reasons that IMEs are done now, but it's new that it's specified like that. That's something that the bill did in addition to sort of create this task force to decide if further sorts of restrictions, regulations, or developments in the IME process would be necessary for the legislature to consider. I think it's fair to say, and Jim, I don't want to put you on the spot, but I'd be remiss. I've talked to a lot of self-insured employers about this bill, and I think, one of the things that's of quite a bit of concern is this notion, and it was certainly drafted into the bill as it was originally introduced and started moving through the process, this notion that the department should schedule all IMEs, including self-insured IMEs, and schedule them according to the kind of random allotment, random selection process, I suppose. And, I know it'll be a very important point of view from the self-insured community as this working group gets underway and as this issue keeps going forward, that the self-insured employer retains its current discretion and authority to schedule their own IMEs, subject to whatever rules end up being adopted, obviously, but it would seem incongruous with the trend of rules modernization and sort of building confidence in the work of the self-insured employers to manage their aspects of their own claims to hand over that issue to the department, and probably one would think invite some fairly significant delays into the scheduling of IMEs for doing that. So I don't want to put you on the spot with any comment on that. That's my comment, but I think that'll be a really important issue for us coming out of this bill, is to retain that ability.
I think the idea of having a work group to consider the various aspects of that will be important. And I think there's been a lot of good work done with the rules recently, and with the communication to workers around various actions taken in claims. I think that the comprehensive goal-oriented core curriculum is going to help support in those processes as well. And I'm optimistic that as folks focus on mutual objectives, that they can explore possibilities and get to a shared understanding about what may work best.
I hope so. So that's IMEs. The actual material in that bill, folks should know, surrounding the IME process was set to start January 1st of 2021. So, and I think that includes some of the rulemaking discretion or delegation to the department as well. The work group has to meet in the interim and report back to the legislature in December. So we figure that will probably get underway pretty quickly as work can happen under the circumstances that we find ourselves in.
Right, right.
The other bill, very interesting, House Bill 2409, and this is worth talking about a little bit. This was a bill, much like the other one. It was not did not come from the employer community. It was not something that the employer community supported until, well, never actually, but at the very end, sort of worked out a significant kind of step down from that bill as it was originally introduced. What it does from the sort of two things, the way it was passed. It increases the amount of a bunch of different penalties that exist in the workers' comp system, for all employers. In one instance, for medical providers, some of them are paperwork type penalties, record keeping and reporting, and so on. Some are, in the instance of healthcare providers, filing timely reports and so on. The argument was that these are penalty levels, kind of money penalties, fines, if you will, that hadn't been increased in quite some time. And so there was an appetite by the legislature to revisit them and increase some of those amounts, and then tie them to inflation. For self-insurers, the bill did quite a bit. On the penalty side, it increased the current penalty amount for the delay or denial of a benefit payment from $500 or 25% of the benefit amount due to up to $1,750 or 25% of the benefits due. And so in that move from 500, let's put the percentage off for a minute. The 500 or up to the 1750 builds in some discretion on the part of the department to kind of weigh the severity, I suppose, of a penalty request to figure out how much to penalize. It also did something else that's kind of controversial, but was pretty heavily negotiated down in the last few days. Right now, the penalty practice of the department, Jim, I think it's fair to say, is that you, when you're faced with a situation where there's an underpayment or an unreasonable denial of benefits, you aggregate the underpayment and then impose a penalty based on that aggregate amount. And that's been a policy and practice that the board has upheld and so on. This legislation changes that a little bit by giving the department the option of either imposing a penalty on the aggregate of benefits that were found to be unreasonably delayed or underpaid, or per each particular benefit payment. So you think like a time loss check that's miscalculated and results in an underpayment. The department under this legislation will have the discretion or the choice to award a penalty either on the full amount of the benefits or each occurrence, each aspect. And the legislation sets forth some criteria for the department to use in making that decision, such as the amount of the underpayment, the past conduct of that particular employer, whether the department had issued an order requiring it, and so on. In other words, sort of a weighing of the severity of the underpayment. So it'll be interesting to see, Jim, how that goes. That part of the new law starts September 1st of this year, and I don't know if you have any comments or any work underway to communicate to stakeholders how those determinations and discretion will be used in the new penalty system.
Sure. Yeah, when we evaluate any of our penalty cases, we do it on a case-by-case basis. And we view the new legislation as doing just what you described Kris, in those two sections. The first section provides the framework of some options for assessing a penalty. And the second part provides the criteria for determining and guiding how we might apply or consider those options that are available in the first part. So we really are looking at those to, the statute gives some pretty clear guidance in terms of framework and criteria. And so right now we think we can, in that regard, manage our processes in accordance with those statutory principles.
Okay. The other part of House Bill 2409 that is going to usher in kind of a new world is a requirement that all third-party administrators doing self-insured claims be licensed in the state of Washington. and the contents of that license is not really spelled out in the legislation. It's referred to the department to adopt some rules that would explain sort of what the requirements and content of the license would be, as well as circumstances where a TPA might lose its license, depending upon what it may be, how it may be found to handle claims. It also, in that, this ties back to our earlier discussion about certification and testing. It also says that all claims administrators handling a Washington self-insured claim, whether in-state, out-of-state, everybody touching a claim has to be certified. And the legislation, that part of the legislation takes effect July 1st of next year. And directs the department to flesh that out in rules. My comment, that was a little bit frustrating to see the legislature do that around certification, in the sense that we'd kind of worked out a framework in the rules modernization piece that we talked about earlier that is still phasing in and has now been kind of delayed a little bit because of COVID-19. But this will require some retooling of that structure, I would think, to handle the additional folks that would now need to be certified after 2021. And an interesting provision in the law as it passed is that the rules that the department, the new rules that the department makes around certification have to incorporate rules that were in effect as of March of 2020. And that was the rules modernization pieces around testing and certification. So that would be sections 350 and 360 in the WAC self-insurance chapter 29615. It'll be interesting to see how that happens, because the new requirement is in conflict with those rules, but has to incorporate them. I think it'll be important to maintain certainly some of the distinctions that were successfully worked into the existing rules around, how much actual claims administration counts as claims administration for purposes of requiring the certification, for example. I mean, are we, there's that range of work from clericals, simply clerical work, to maybe medical only auto adjudication type work, where it's a real question whether that type of work merits the requirement of certification. At the other end of the employer's organization chart, there's the CFOs and the VPs of human resources and others who might just simply sign off on claims management decisions but aren't involved in the actual adjudication of them, and not requiring certification of those folks too. Those are very important pieces of the existing rule, and I think that's something that we'll definitely want to see incorporated into whatever this new world looks like around all all claims handlers in self-insurance being certified.
Yeah, I'm really glad that we built that framework for the in the earlier rules, because I agree, Kris. I believe it's going to inform any discussion we have around the development of these new rules. And as you noted, under this new legislation, it actually requires that the department adopt new rules. So we have new rules in the other one that are permissive, new study that's required for a work group, and then there's this one where rules are actually mandated by the statute for the department to enact. So, but I feel confident with the work that's already been done into delineating out those factors that you just mentioned are going to be really important to help inform that discussion as we go forward. And I would anticipate that we will have some form of work group of business and labor representatives to work together on that.
Well, that's the legislative report, I guess. One last area to talk about. I think I'm not keeping a timer. I think we've probably exceeded our hour, but hopefully this has been informational for folks and of value to them. One last area before we sign off, Jim, is rules that are going on right now, and so self-insured folks might not be completely aware that this is happening because it's sort of in the early discussion phase, and for that reason, I know it's all tentative and all just kind of trading concepts. But there's some work going on. Folks should know about doing a rules modernization project, not on the claims rules, which we worked on a couple of years ago, went into effect last year, but rather on the financial rules around self-insurance. From the threshold requirements for certification to the financial requirements for maintaining certification once it's awarded, issues related to the insolvency trust, to the second injury fund. I mean, kind of the dollars and cents side of insurance. Jim, could you just give us a brief kind of overview of what's going on right now in that area?
Yeah, absolutely, Kris. Thank you. We're making steady progress in modernizing our financial rules for self-insurance. We have a talented work group made up of representatives from business and labor, some of our insolvency trust board members, and from that are made up of self-insured employers that are from business, but then we also have some labor members. We're looking at this together at how we can best integrate sound financial principles into self-insurance qualifications and maintenance. For example, using measures such as net worth and revenue instead of assets that are more reflective of an employer's ability to pay benefits to injured workers. And also using modern financial industry tools such as credit ratings from Moody's or Standard & Poor's that will help us more objectively evaluate the criteria for either qualification and maintaining those qualifications as we go forward. And but we're being careful, and and taking our time, Kris. As you know, we've spent some time, quite a few meetings actually, getting kind of laying a groundwork really. But we want to be careful and take our time, especially in view of the economic uncertainty resulting from the pandemic. We want to be sensitive to the current environment. And our aim really is to develop a framework that is responsive to modern business practices and respectful of mitigating circumstances. We're really trying to balance both those things out.
Yeah, and I think I'm part of that discussion group, and I think it's been really interesting discussions so far, and I think that where we probably have a real point of common ground is both that we update the the things that the department's looking at to really reflect modern business realities and not, industries that as they existed 50 years ago, for example.
Right, exactly.
Also to provide a certain measure of predictability and certainty when a prospective self-insure, when an employer applies for self-insurance or has to make the necessary reports to maintain self-insurance and to make it a little bit more predictable and certain what all is involved there. So I think that that's a common goal that we share, and as these discussions move more formally into the rulemaking process, hopefully something that we're able to accomplish. Well, Jim, I think we've come to the end. It's been at least an hour, I think. I really want to thank you for your time this morning. Want to reiterate what I said earlier, that viewers of this segment haven't been able to participate with questions on any of these issues, although I'm sure things we've said may have stimulated some. So if folks can email me at WSIA, it's kris.teft@wsiassn.org. I will make sure that those questions get answered by the appropriate person, whether it's me or Jim or one of Jim's staff or others at the department. So I want to really encourage that if anything we've talked about gave rise to some questions. Jim, before we close this down, I want to give you the microphone. Any last thoughts?
Yeah, thank you, Kris. I share often with our stakeholders that we want to be a reasonable regulator. And to be a reasonable regulator, we need to be a constant collaborator. And to be a constant collaborator in these times, Kris, we need to be a connected collaborator. So we really appreciate the opportunity today to connect with all of you through this video presentation. So thank you, and thank you, Kris.
All right. Thank you very much, Jim. Signing off.